So what about the future of street drugs? So we just talked about where we were previously. Where are we going in the future? So N-Bome is something that's going to ruin our lives in 10 years. So this guy who's doing a PhD paper is like, yeah, I found this thing that's basically 100% serotonin agonist. It's a partial agonist, but it is nearly 100%. And then he published it. And it turns out that some drug addicts really read the literature a lot, and they found out how to make it with really cheap products, okay? So this is going to be something that's going to ruin our lives in 10 years once this becomes more and more popular. It is showing up in America, but it is so incredibly potent because it is much more effective than LSD. It's like a cousin of that. And there have actually been people that have died from it. And honestly, we don't know why they died, because they just took it and then they died, okay? But people dissociate so hard from this that it may actually be inducing seizures and whatnot, and we don't know because people aren't using this in the lab. So designer drugs are becoming more and more common. The pharmacology is incredibly messy. What happens is Congress says, look, you can't make this particular drug, and then a street chemist says, okay, I'll attach a methyl group to it. And so that's what they do. And do they know what's going to happen when they put a methyl group on that? Hell no. They have no idea what's going to happen. And so what do? They sell it, and if people get high, great. And if they don't, well, they try something else, and they put an alkyl group on it or something like that. So that's what we're doing now. And they keep trying to get ahead. The lawmakers are slower than the drug dealers. They will never catch up. No matter how many things that you say are illegal, you know, oh, this brand of bath salt's bad, and you can't do that, and you can't do that. They will find a way to put stuff on it until they make people high. They just will. Okay? That's not necessarily an argument for making them legal. It's just you should be aware that they're constantly on this like cat and mouse game. They're going to stay one step ahead by adding stuff. And they have no idea what this stuff is going to do to people. Zero. Okay? You think we have poor information about like what happens if people do a lot of acid? Well, you're right. We don't have very much information. We have zero information about the stuff that kids are taking nowadays. And then there's the question of designer purity. So they start mixing all this stuff together, okay, including active placebos and whatnot. They just put extra stuff in there that intentionally burns. And it's because it's going to make it so that the person feels like they're going to get higher, okay, because they put some niacin in the pill or whatever. And so that's actually happening. People are mixing things together, and no one knows what's going to happen from that. So even if someone says, yeah, I bought some Molly from a guy, he has no idea if that's MDMA. They could have sold him anything, okay? Because there's no better business bureau for this. Like you can't go complain somewhere if they sold you something bad, okay? And the fact that one of the most potent things ever, N-Bome, is actually cheaper to make than LSD makes it an incredibly bad combination because it's both cheap and potent. And that's a rarely seen thing in drugs. So, questions? So that's actually a very good point, actually. A lot of these chemicals are actually dermally absorbent. So particularly if they get wet, don't touch wet blotter paper. I know this sounds silly, but it will actually get absorbed through your skin. And so this goes along with the idea of chemical decontamination, that you need to make sure that if there is an unclear substance on someone that you also don't get high from it.